The five elements. The five elements are a concept in ancient Chinese philosophy referring to the nature of materials as well as their interrelationships. The concept was later introduced into Chinese medicine philosophy for clinical applications. The five elements refer to wood, fire, earth, metal, and water. In Chinese medical philosophy, the five elements theory consists of 4 laws governing the relationships among the 5 materials. According to this theory, the 5 viscera are viewed as the key organs and the 4 laws are applied to them. The 4 laws are the laws of production, control, attack, and resisting control. The correspondence between the 5 elements and the 5 viscera is as follows. Wood corresponds to the liver, tendons, and eyes. Fire corresponds to the heart, blood vessels, and tongue. Earth corresponds to the spleen, flesh, and mouth. Metal corresponds to the lungs, skin, hair, and nose. And water corresponds to the kidneys, bones, and ears. The laws of production and control are used to illustrate the interrelationships among the viscera. For instance, the liver controls the spleen, which is called wood controlling earth. The spleen produces the lungs, which is called earth producing metal. And the lungs control the liver, which is called metal controlling wood. Thus, there are patterns of relationship among the 5 viscera according to the laws. The laws of attack and resisting control are used to describe pathological changes as well as methods of treatment. For example, since liver disease will affect the spleen, it is called wood attacking earth and should be treated by inhibiting wood and supporting earth. And in treating lungs energy deficiency syndrome, it is necessary to strengthen the spleen and tone up the lungs, which is called developing earth in order to produce metal. The 5 elements theory is based upon clinical experiences and very useful in clinical practice. The 4 laws of the theory can be summarized as follows. The first law, the law of production, states that one organ can produce another organ, which indicates a mother-child relationship between the 2 organs. The mother organ is capable of assisting the child organ in its capacity for growth and nourishment. According to this law, wood produces fire, fire produces earth, earth produces metal, metal produces water, and water produces wood. The law of control states that one organ can control another organ. According to this law, wood controls earth, earth controls water, water controls fire, fire controls metal, and metal controls wood. The law of attack states that one organ can attack another organ, which means that one organ may abuse its power of control and attack another organ. Thus, an abuse of the second law will lead to the application of this third law. As an example, when the energy of wood is in excess and at the same time metal fails to control wood properly, wood will manage to attack earth, which may cause liver wood in excess with spleen earth in deficiency. The law of attack falls within the context of pathology. The 4th law, the law of resisting control, which can also be called the law of rebellion, states that one organ may resist control by another organ, which means that the employee may resist control by the boss, so to speak. This law is a reversal of the law of control, and thus it falls within the context of abnormal relationships among the internal organs. As an example, under normal circumstances, metal should control wood, but if the energy of metal is in short supply, or if the energy of wood is in excess, wood may resist control by metal, which gives rise to lungs, metal, in deficiency with liver wood in excess. Energy, blood, and body fluids. Energy. Energy is the motor of all human activities. All human activities are a function of energy. When energy is disordered, it can cause various types of organ disorders. Conversely, organ disorders can cause energy disorders. The disorders of energy are generally divided into 2 categories, deficiency and excess. Deficiency means shortage, with symptoms of low functioning and decline. Excess means too much, with symptoms of congestion and blockage. With an energy deficiency, there is a functional decline of the internal organs and a low resistance of the organism against the attack of diseases. It can be seen in chronic diseases, aging, or during the recuperating stage of acute diseases. The general symptoms of energy deficiency include white or pale complexion, fatigue, weakness, poor spirits, shortness of breath, too tired to walk, too tired to talk, low and feeble voice, excessive perspiration, tongue and light color, and weak pulse. In order to treat it, it is necessary to tone up the energy. An excess of energy manifests itself in energy sluggishness or stagnation. Energy should travel throughout the body without difficulty. However, various factors including emotional stress, irregular eating, attack of external energies, and external injuries can impact energy circulation negatively and cause energy sluggishness in the chest. They can also cause swelling of the stomach and abdomen with pain if they involve the stomach and intestine, with wandering pain occurring most frequently and swelling more severe than pain. Other symptoms include intestinal rumbling, pain, getting better on belching, and pain and swelling of breasts in women. In order to treat it, it is necessary to promote the flow of energy and break up energy congestion. Another type of energy disorder is called energy upsurging or energy rebellion, which may be seen in cough and asthma due to lungs energy upsurging and in nausea and vomiting as a result of stomach energy upsurging. Blood. Blood is a product of water and grains undergoing energy transformation, and it is closely related to the heart, spleen, and kidneys. There are three basic types of blood disorders: blood deficiency, blood coagulation, and hot blood. Blood deficiency means a shortage of blood due to the loss of blood or insufficient production of blood. Blood deficiency can be seen in anemia, chronic waste disease, neurosis, parasites, and irregular menstruation with the following symptoms: pale complexion, light color of nails, light color of tongue, and fine pulse. There may be an empty pulse after massive bleeding. In order to treat it, it is necessary to tone up the blood or strengthen the energy and tone up the blood at the same time. Blood coagulation or blood stasis can be seen in coronary disease, menstrual pain, suppression of menses, extrauterine pregnancy, external injuries, and carbuncles, with such symptoms as acute pain in the affected region, mostly prickling pain in a fixed region, and pain getting worse on pressure or local swelling with lumps, pain in the lower abdomen before menstruation, scant menstrual flow in purple-black color, and in lumps in dark purple color of tongue with ecchymosis on the tongue. In order to treat it, it is necessary to activate the blood and transform coagulations. Hot blood is mostly seen in hot diseases of external causes such as measles, scarlet fever, and encephalomyelitis. Sometimes it can also be seen in such diseases as allergic purpura, aplastic anemia, and leukemia, as well as various diseases of bleeding. The following symptoms may be present: red, swelling, bleeding, skin eruptions, premature menstruation, excessive menstrual flow in fresh red color, mental depression, thirst, reddish urine, and constipation or fever, red tongue with a yellowish coating, and a rapid pulse. In order to treat hot blood, it is necessary to cool the blood, clear up heat, and counteract toxic effects. Body fluids. Body fluids refer to the water in the body under normal circumstances. The functions of body fluids are to water and lubricate internal organs, muscles, skin, hair, membranes, and cavities, lubricate the joints, and moisten and nourish the brain, marrow, and bones. Body fluids can be divided into clear fluids and turbid fluids. Clear fluids are spread in the muscles and membranes to moisten the muscles, skin, and hair, as well as the cavities of the senses, namely the eyes, ears, mouth, and nose. Perspiration and urine are products of clear fluids. Turbid fluids are spread in the internal organs to nourish such organs as the brain, marrow, and bones, and to lubricate the joints, but at the same time, they also have the function of nourishing the muscles. The production, distribution, and excretion of body fluids go through a relatively complicated process in close relationship with the lungs, spleen, kidney, stomach, small intestine, large intestine, and bladder. The Yellow Emperor's Classics of Internal Medicine states, after food enters the stomach, its pure energy is transmitted upward to the spleen. The spleen in turn spreads the pure energy to flow upward to the lungs. The lungs reopen and regulate the passage of waterways in order to transmit the energy of water to the bladder below. The pure energy of water then spreads in 4 directions and travels to irrigate the meridians of the 5 viscera. This means that the source of water comes from the stomach, which transmits the pure energy to the spleen. Through the transporting and transforming functions of the spleen, the fluids from the stomach are sent to the lungs, which spread the fluids to various internal organs. Wood corresponds to the liver, tendons, and eyes. Fire corresponds to the heart, blood vessels, and tongue. Earth corresponds to the spleen, flesh, and mouth. Metal corresponds to the lungs, skin, hair, and nose. Water corresponds to the kidneys, bones, and ears. When foods pass through the small intestine and the large intestine, body fluids will be absorbed through the function of the small intestine in separating the clear fluids from the turbid and the function of the large intestine in transporting and transforming waste matter. This accounts for the assertions in the classic that the small intestine takes charge of clear body fluids and the large intestine takes charge of turbid body fluids. These assertions point to the connection between body fluids and the small and large intestines. In short, the production, absorption, and transportation of body fluids are inseparable from the receiving function of the stomach and the transporting and transforming functions of the spleen. The distribution of body fluids throughout the whole body to moisten the skin and hair and the transformation of body fluids into perspiration and urine are inseparable from the expanding, dispersing, cleaning up, and pushing downward functions of the lungs, which is why the lungs are considered the upper source of water. Among the internal organs, the kidneys play a very important role in the production and metabolism of body fluids. This is because all the organs involved in body fluids depend on the warming and pushing power of the kidneys, including the stomach, which receives water, the spleen, which transports and transforms water, and the lungs, which spread and clean up water. In addition, the production and excretion of urine and the metabolism of water throughout the whole body are inseparable from the transforming function of the kidneys. This is why it is said that the kidneys are water organs and they take charge of the water throughout the entire body. Insufficient body fluids and failure of water to transform into body fluids with water retention are the 2 basic pathological changes in metabolism of body fluids. Insufficient sources and excessive loss and consumption are the 2 basic causes of insufficient body fluids. The first cause may be due to insufficient intake of water and failure of water to transform into body fluids. The second may be due to the attack of a hot pathogen, excessive perspiration, vomiting, and diarrhea. Causes of diseases. The 6 external pathogens. The 6 external energies are wind, cold, summer, heat, dampness, dryness, and fire, which stand for changes in climate during the 4 seasons. When these 6 external energies attack the human body through the mouth, nose, or skin to cause superficial disease, they are called the 6 external pathogenic energies or the 6 external pathogens. Wind is one of the 6 external pathogens. Wind can cause disease along with another external pathogen. So a given disease may be caused by a combination of 2 pathogenic energies, such as wind cold, wind heat, wind dampness, or wind dryness. Wind is a yang pathogenic energy, and when it causes disease, it will give rise to wandering symptoms and symptoms that change a great deal. Wind can refer to external wind and internal wind. As one of the 6 external pathogenic energies, external wind attacks the human body from the outside. Internal wind, on the other hand, causes disease from within. When heat and fire reach their peaks, they may be transformed into internal wind. Blood deficiency with yin exhaustion and energy and blood disturbances may also generate internal wind. The symptoms caused by internal wind include vertigo, fainting, twitching, trembling, numbness, and dry mouth and eyes. Injurious wind refers to the disease caused by wind, normally called the common cold. In clinical practice, there are two types: common cold due to wind and common cold due to wind and heat. The two types are treated differently. Cold. Cold is one of the yin external pathogenic energies that can easily cause harm to yang energy. When a person's yang energy is in deficiency, defense energy will fail to guard the body against foreign invasion, so cold energy will attack, giving rise to such symptoms as dislike of cold, fever, headache, pain in the body, pain in bones and joints, and abdominal pain with diarrhea. Like wind, cold can be divided into external and internal types. External cold refers to the cold energy that attacks the body from the outside. External cold causes a blockage of yang energy with such symptoms as dislike of cold, fever, absence of perspiration, headache, pain in the body, and superficial and tight pulse. External cold can also refer to a weakening of yang energy in the body with such symptoms as fear of cold and being very susceptible to an attack of the common cold. Internal cold refers to a weakening of yang energy with a decline in organ functions that may give rise to disturbances of water transformation, retention of urine, and the like. There can also be a direct attack of cold referred to as cold stroke. This is when the cold pathogenic energy attacks while the person is suffering from yang deficiency. The symptoms may include cold limbs and deep and fine or slow and tight pulse. Summer heat. Summer heat is one of the yang external pathogenic energies. When summer heat attacks the body, it will give rise to such symptoms as headache, fever, thirst, mental depression, excessive perspiration, and forceful and rapid pulse. Summer heat can also cause great harm to body fluids, which in turn leads to such symptoms as fatigue, weak limbs, and dry mouth. In certain regions, when a great deal of dampness or humidity accompanies a prolonged summer heat can attack the body along with dampness to cause such symptoms as congested chest, nausea, vomiting, and diarrhea. Dampness. Dampness is one of the yin external pathogenic energies. It has a turbid, heavy, and sticky nature and can also obstruct the activities of energy transformation performed by the spleen. There are internal dampness and external dampness, and they cause different symptoms. External dampness refers to the dampness outside the human body, such as on the ground, in the air, or of rain and dew. It may give rise to such symptoms as heavy sensations in the head, as if being wrapped up by a wet towel, soreness in the back of the neck, congested chest, sore loins, tired limbs, and sore joints. Internal dampness refers to a stoppage of dampness within the body, normally due to an inability of the spleen to transform dampness because of spleen yang deficiency. When this occurs, the patient will display such symptoms as poor appetite, diarrhea, abdominal swelling, scant urine, yellowish complexion, edema in the lower limbs, light color of the tongue, and relaxed pulse. Dryness. Dryness can be divided into internal dryness and external dryness. Both internal dryness and external dryness, one of the 6 external pathogens, can cause exhaustion to yin fluids. Symptoms of external dryness include pink eyes, dry sensations in the mouth and nose, dry lips, pain in the ribs, dry cough, and constipation. With internal dryness, the exhaustion of internal yin fluids is mostly due to a later stage of heart diseases or the result of vomiting and diarrhea, excessive perspiration, excessive bleeding, or improper use of drugs. The symptoms of internal dryness consist of hot sensations as if heat were coming from the bones, mental depression, dry lips, dry tongue, dry skin, and withered nails, which are symptoms of yin being harmed by heat.